After looking through some of our resources for this assignment, I decided to focus on the essential health benefits that came into place under the Affordable Care Act. So, whenever Obama put the Affordable Care Act into place, he put into law that when you are under a health plan, that this health plan has to include 10 essential benefits. And the 10 essential benefits, according to Kaiser, include preventative wellness and disease management services, emergency care, ambulatory services, hospitalization, maternity and newborn services, pediatric services, including dental and vision, prescription drugs, lab services, mental health and substance abuse services, including behavioral health treatment and rehab services. So before the Affordable Health Care Act, health insurance was not required to cover the benefits. So if someone had was able to go see their primary care provider, that's great. They got treated and diagnosed for hypertension, and then they go to pick up their medicine and they find out that their insurance doesn't help pay for their medicine. So now with the ACA, prescription drugs were mandated that they should be covered for under the Affordable Care Act. Also with preventative wellness and disease management services, according to Jean Folger with Forbes, she also stated that as long as the service was delivered by a network provider, the consumer would not owe a co-payment or anything out of pocket for certain preventative measures such as blood pressure screening, cholesterol screening, vaccinations, HIV screening, pap smears, stuff like that. All that would be covered because of the Affordable Care Act's essential health benefit. But under Trump's new American Health Care Act, the ACA's requirement to cover the 10 essential health benefits will continue until 2020, and then in 2020, states can opt to waiver to redefine what the essential health benefits include. So Kaiser states that health insurance coverage will be different across states, and your insurance plan may or may not cover your preventative health care screenings or your preventative immunizations. And I just find that to be kind of a negative change that the American Health Care Act is putting into place. I believe the Affordable Care Act putting in the benefit mandate is a great thing, especially with the preventative care, because I believe preventing a disease is very cost saving, and that's something that is obviously a big issue with our current healthcare system, is just how ridiculous some stuff costs. So leading into the next question, in whether I believe that healthcare is a right or if it's a privilege or something that should be bought by a consumer. For me, it depends on the situation. I believe that if someone is able-bodied and able to go to work and may be able to get insurance through their employer, they should do that. I don't think healthcare should just be handed out to anyone. If they're able to actually obtain it themselves. But I also believe that healthcare is a right, especially for the vulnerable populations that aren't able to work. that are too sick to work, or especially children with parents that don't have insurance coverage. If a child came in and needed emergency surgery, I don't believe the child should be denied that emergency surgery just because their parents can't pay for it. So there's obviously something that needs to be done about our healthcare crisis, and I think that both President Obama and President Trump realize that there is an issue with our healthcare system, and they both have tried or are trying to make changes to fix it. But I don't believe either healthcare acts are what's going to solve America's healthcare problem. So, thank you.